Hey, in this session, we're going to talk about placement of a laryngeal mask airway, or an LMA, also known as a supraglottic airway device. And the reason it's called an SGA, or supraglottic airway device, is because this is one of those that sits above the glottis, so it is going to sit in the hypopharynx, and we're going to be able to ventilate our patient utilizing this method. So a little bit different than an endotracheal tube, which actually goes subglottic or is placed subglottic for the tip of it. So how are we going to do this? So we're going to take our patient, and obviously we're going to induce general anesthetic on them. So we're using the methods we've talked about before in other videos, where we're looking at lidocaine and propofol. In this method, we actually don't need to use a neuromuscular block aid at this point for placement of the laryngeal mask airway, or the LMA. So we're really just using lidocaine and propofol for induction. So our patient now has been put to sleep, and we're now ready to place this LMA. We have them unconscious. So here what we're going to use is an LMA. Now, what we'll see is there's a couple of different techniques, and let me just mention some of those. Now, Dr. Brain, I believe it was in about 1989, invented the LMA. And when you look at the insert on this and the way that he had really designed this to be inserted, was you would actually deflate this cuff here. You would deflate it all the way during insertion. Now, what we really see in a lot of our practices now is we do have it partially inflated. And part of that reason is when it is fully deflated, what we have a little trouble doing is as we're inserting it and as we are guiding it to the hypopharyngeal region, we will see this cuff actually bend back on itself, and it's a little bit hard to see it at that point in time. So you'll see that we actually, for a lot of us, have a slight inflation of the cuff, so that it helps kind of keep a little bit of structure on it. We also will take petroleum jelly. We'll take something like a KY jelly, and we will make sure we lube this up really well so that it can slide down the airway without really scratching it or causing a lot of damage to the oral airway and to the tissue there, which would create obviously a very sore throat in that instance. So let's say we've got this lubricated with our jelly. Let's say we've got our patient already asleep, and now we're ready to place the LMA. A couple of different techniques that you'll see. Some people will take a tongue depressor, tongue blade. They will then insert it in here to get the tongue out of the way, and then they're going to insert the LMA. Now, the technique that I use when I'm inserting the LMA, just to show you, is I hold it almost like a pencil. So I have my finger down here near the cuff, and I've got my hand kind of running up on the shaft. And the reason for that is really because I feel like I can control it real well when I'm starting to push the LMA, when I've got my hand here in this position. So I will then take this LMA, I will insert it, I'm pushing it up towards the roof of the mouth, and then I'm letting it run down the back of the throat in the anatomical structure or anatomical way that we have. And then I will keep inserting it with my finger as far as my finger will go. Then I can take the tongue blade out and push it the rest of the way from up top to where it will then just seat right above the epiglottis in that subglottic or that supraglottic region. Then what I'm going to do at this point is I'm then going to take my syringe. Usually we're going to have something a little bit bigger than a 10 cc. We'll usually use a 30 cc syringe. And then I'm going to inflate the cuff the rest of the way. Now, I'm not sure if you saw that in the video, but what you would see here, and it did it slightly, is this actually raised up a little bit. That was showing that it's seated well. And then at this point, once we have it seated, we're then going to take the reservoir bag that we have our circuit connected to. So we'll connect our circuit here. And again, just imagine this is a circuit for an anesthesia machine, and this is your reservoir bag. Then we're obviously going to connect it and squeeze it to ensure that we're moving air as we see both lungs rising here, that we can make sure we're moving air at that point in time. That would indicate that we have this properly placed. Now, as a second technique of inserting this, and I have found that this works really well in a lot of my practice, is when we start thinking about the fact that why this LMA doesn't really seat well, or why we don't get it placed well, is I will again have it partially inflated just like I talked about, but instead of using a tongue depressor, I will actually put my finger here in the mouth. So as you can see here, I'm putting my thumb in the mouth, and I'm grabbing the rest of the chin with my other part of the hand with the other fingers, the other four fingers. What I'm doing is I'm pinching that tongue to the bottom of the mouth, and then I am lifting up. And the reason I'm doing that is because by doing that, I'm actually pinching the tongue to get it from falling down into the back of the throat and occluding. And then by lifting up, I'm actually opening the oral airway, giving myself more room to work. And then what I'll do then at that point is, again, follow that technique where I put the LMA in, and then I will push it down as far as I can with my finger, push it the rest of the way after that until it won't float anymore. And then I will inflate the cuff. As I inflate the cuff, I should see it rise a little bit, which we just saw there. Connect my circuit, squeeze my reservoir back, and at this point in time, then I should see both lungs start moving, which you see here, inflation of the lungs. So now I know that I am seated well. And this is how we place a laryngeal mask airway or an LMA. So I hope this helped you, at least in understanding a little bit about a supraglottic airway device and the placement of that as we talk about airway management.